is happening to DR Congo? I don't know if you guys remember the Ebola stories that we ran about DR Congo some time ago. It doesn't seem to be going down. In fact, the World Health Organization, they are saying that out of 2 people, 1 person dies every 30 minutes. But the bigger question is West Africa in danger? Is Ghana in danger? What are they saying about that? And what at all is happening in DR Congo? Let's get straight into the details of the story. So if you remember, we ran a couple of stories some time ago about what DR Congo and how the Ebola outbreak is back again. Now, they are saying that this one is even deadlier than the 2014-2016 one that we had in West Africa. Why? Because what? The virus or the strain is different. The first one we had was Zaire. We had vaccines for that, but this particular one is what Budimbugyo or Budimbugyo. And then till now, we have not been able to develop any vaccine for it. Let's do a little bit backstory of how the Ebola came about again. So on the 24th of April 2026, there is this frontline nurse in Bunia, the capital of Ituri province in DR Congo. This lady began having symptoms of the Budimbugyo virus. But you know, it looks like symptoms of the regular malaria or common cold. So they mistook it for that. But aside that, they ran a couple of tests, you know, including the Ebola test. But for the Zaire virus, so it came out negative for the Ebola. But a few days later, this nurse lost her life. And this is where it got alarming. Then they took, you know, they did more tests in the capital of Congo, Kinshasa. And this is where they were identifying that, okay, it is actually not the regular Zaire Ebola virus, but rather Budimbugyo. But over here, before they did all of this thing, it was too late because what the lady handled patients, colleagues, friends, families, even the funeral. And with this Ebola, whether you are alive or off, someone can still contract it from you. So this was what caused the outbreak from that time.
It's a grim milestone. The current Ebola outbreak in the Democratic Republic of Congo is the deadliest in the country's history and the second most lethal on record. It's also spreading 5 times faster than previous outbreaks in Congo did at this stage, health officials say.
You're still running behind the epidemic. It's still very high, intense transmission.
How come the outbreak is so deadly and spreading so quickly? As a rare strain, the virus got a head start and spread undetected for months. Early cases of the Budimbugyo species were missed or misdiagnosed. Health workers at first relied on tests for the wrong Ebola type, and samples were mishandled. A July report in Science Journal concluded the outbreak began in January at the latest, but it wasn't declared until May. The virus is spreading faster than it is being tracked. About 80% of new infections emerge outside known transmission chains, according to the World Health Organization. Late detection means more people die. The fatality rate has risen from about 20% of cases in late June, which was probably an underestimate, to 47%, according to government data.
Now, because the public is now learning of the new strain Budimbugyo, people think that it is a newly mutated virus. Actually, it isn't. It has been discovered since 2007. In Uganda, a part of Uganda known as Budimbugyo, hence the name after the strain. Now, DRC has recorded, this is alarming, total confirmed cases is 4,945, almost 5,000 cases, and the recorded deaths are 2,325. And then the fatality rate is approximately 46%. So if there are 2 cases, according to the WHO, if there are 2 cases, 1 person is sure to lose his or her life. And the worst part of this situation is that there is a shortage of staff, of health workers in the hospitals, at the quarantine centers. And you see, I was thinking that this is actually the worst part. But the worstest part is that some of these health workers have gone on strike. Because since they began working, as far as this Budimbugyo whatever thing is concerned, they have not been paid. Securities, drivers, even the funeral people, those who, if the people lose their lives, because it has to be private, the people that are involved in that private funeral, they don't also pay them as well. So these people have gone on strike. Aside that, the centers that are accommodating these patients, they are far stressed beyond capacity, forcing some of them to go inside the remote areas, with the limited staff. Talking about remote areas, those remote areas too, some of them are just conflict-prone zones. So it's like back-to-back problems. Aside the a whole virus something, there are internal problems that are limiting flow of work and flow of cash according to the government. And WHO is saying by far, so far, this is the deadliest one that they've recorded. That is even deadlier than the previous one that we've had. And there is a likelihood that it will spread to other countries, especially Central Africa and Eastern Africa. So far, Uganda has recorded 20 cases with 2 deaths. There was a time that I think in May, they even closed their borders because it was getting too much. Just watch this video.
This is officially the deadliest Ebola outbreak in the history of the Democratic Republic of Congo. Government data has confirmed 2,325 deaths, surpassing the previous death toll record from the outbreak between 2018 and 2020. The current one is caused by the Bundibugyo strain of Ebola, which has no approved vaccines or treatments. Its fatality ratio is nearly 1 in every 2 cases. At this point, nearly 5,000 cases have been confirmed, and that number is expected to rise. This outbreak has gained momentum since it was declared on May 15, but officials believe it may have started as early as February. Efforts to stop it from spreading have been hindered by weak health infrastructure, community resistance, and political instability. Ebola spreads through direct contact with the bodily fluids of infected people, living or dead. It can cause fever, vomiting, diarrhea, and, in severe cases, internal and external bleeding.
It's unacceptable for a healthcare worker who is putting their life on the line and then not get paid for their humanitarian work. And that really does fall on the government of the Democratic Republic of Congo to pay these individuals. But with that said, Diego, this is also a global health emergency. That also means that the world needs to step up collectively to get a hold of this.
Now, I asked a question earlier about if West Africa is in danger or Ghana specifically is in danger. Well, the WHO is saying that no, West Africa is at low risk of, welcoming this thing. But because of illegal movements, they are unable to trace some people or records of this kind of cases. So by all means, through the desert, through whatever that they cannot trace, people move. Hence, it is still possible. So their advice to every country, including Ghana, is that we should strengthen our borders, our ports. There should be checks every time someone comes from any form of neighboring countries around in those areas. We should check them. And also make sure that we have some level of preparedness in case this calamity befalls us. But there is a good news so far, because scientists from Oxford University have partnered with the largest vaccine manufacturer in India by volume so far, to produce a vaccine using the same technology they used for the COVID-19 vaccine production. And so far, they've produced 620,000 vaccines. It is there. They are still in testing mode. So they've supplied about 4,000 for human testing. The first testing happened on July last month, 24th. And so far, they are still in that mode. It is not entirely public yet. So they are monitoring how it will go. If it goes well successfully, all that, so it's still 20,000 to Africa. We're just hoping that this works out and then the Ebola situation will be curbed. This is Gossip 24. I'm Kim Elena. Don't forget to like, don't forget to share the link, don't forget to subscribe if you haven't. And as usual, don't forget to comment your comments in the comment section. For now, peace out.